Corona Alert with Carrie Harrison, providing facts, not fear.
Carrie Harrison with you, and as we provide facts, not fear, and help you navigate the shoals of COVID-19 and all the different permutations and the new realities that we all seem to be suffering, I want to bring to you a special physician with a wide spectrum of skills whose expertise on this will be invaluable to you. His name is Dr. Habib Sadeghi. He served as an attending physician and clinical facilitator at UCLA Santa Monica's Medical Center, currently a clinical instructor of family medicine at Western University of Health Sciences. Dr. Sadeghi, by the way, is also founder of Beehive of Healing, an integrative medical center based here in Los Angeles, where we are right now, specializing in multidisciplinary treatment for chronic illnesses that include osteopathic, anthroposophical,
very good.
Good for me. Environmental, psychosomatic, family, even German new medicine, as well as clinical pharmacology. Also a regular contributor to Goop, CNN, BBC News, The Huffington Post, and the publisher of the Health and Wellbeing Journal, Magazine. I want to welcome you so much, Dr. Sadeghi.
Thank you. Thank you for the invitation. Thank you.
Glad to have you on board. I wish it were just a joyous frolic with no particular topic, but right now we're all living pandemic whoopee. Pandemic meaning across all. This is in effect one human family. No longer is it them and us, but all points of the world are affected. Your day today in the ER must have been as busy as it could be.
Absolutely. I think I can't speak for all the medical doctors, but you're absolutely right. When we look at even just the word pandemic, from pandemos, pan, all, and dem, people, all people. I think you nailed it. This is really from the perspective of all of us being one human family. And every single physician goes through what perhaps my day typically is, which is you wake up, if you can get enough sleep, if the pager doesn't go off and you have an emergency or a particular question, if a patient is not crashing, if a patient is not having chest pain or panic attack because they feel like I can't smell, I can't taste, it must be, COVID-19, am I going to die? And it's 2:00 in the morning and you just, lay down to get some rest. And this is just to be woken up again at 5:00 in the morning and to go back to the hospital to do rounds and to, again, during this time, as much as, we're really or in the front line and treating patients and considering the level of compassion for that human family, we still have other obligations, such as medical students, residents, interns, fellows, and the cultivation of their educational process. That is our responsibility. I mean, if you look at Colombia, if you look at Western University of Health Sciences, most allopathic and osteopathic schools, they're in a process of facilitating the graduation so that we need more doctors. We really need more soldiers on the ground to be able and to handle what's the tsunami that's developing and it's coming our way.
Yeah, and it would not be overblown for me to say we ain't seen nothing yet. And you guys are already, you get your 1.5 hours of sleep a night, on a cot in the back seat. Ooh, I coughed. What is that? So I would be running into you going, and you go, well, you live in LA, the air sucks. But I'm going to forget that because I coughed. And we're constantly reminded by most of the people on the TV that if you cough, but then I can't go get tested. And if I can't get tested, therefore, and I come up with a story in my head and therefore I have it and I'm going to die. I mean, this is probably half of your cases in some ways.
You're absolutely right. This is one of those times that I would probably cite with Freud when he said sometimes a cigar is a cigar. Sometimes a cough, it's just a cough. I mean, it could be so many different things. Not every cough is an indication that it's one of the coronavirus family, or you have COVID-19 as a disease pathology. Sometimes we cough. We need to also remember that we have two tubes in the back. We have the epiglottis, and then we have the trachea. The epiglottis is where we swallow our saliva, and sometimes, the saliva gets back into the trachea, and we cough as a reflex mechanism to clear the trachea, the windpipe, so that we can move forward in our days. So not every cough is really a significance of being worried about it. And one of the things that I appreciate and I love about the line of energy that you're holding and the conversation that you're starting is that you really are paying attention that, look, let's just strip down and get the information and then connect our heart and our brain and think through it with our heart from a place of being grounded and being contained instead of continuously worrying about it and being anxious and having panic attack. And let's face it, most of us, we really are cooped up in a small apartment or a house or a room, or even those of us that they may have a mansion. Sooner or later, really all you need is a small room to be able and to really reflect. Now, if one person in that space, if they're continuously or worried and anxious and fearful, and they go into this place of awfulization, well, we know that through what they do is they hold an energy, and the Wi-Fi or morphogenic resonance through the pheromones that they produce, it affects the rest of the family. This is the time that I would like to encourage all of our viewers and listeners to really consider our children. And they look up to us. They might not seem like it, but believe it or not, it's there is certain level of hypervigilance that is present for them. And as parents and as adults, it's our responsibility to put the oxygen mask on ourselves, contain ourselves, and to be able to go through this unpredictable time from a level of predictability that really oozes maturity, sophistication, and adulthood.
Yeah, I love the mask analogy, and a lot of people don't understand, well, why would I love my child. Why would I put the mask on first? Because, Mildred, if you die and keel over with 135 pounds on a baby, the baby dies, you're already dead. So you have to help self in order to help others. And we forget that. So these are rudimentary and important lessons. Dr. Sadeghi, let's answer just a couple of questions from viewers and listeners who, are freaked out. We're getting multiple mixed messages a day. And this is not a political statement. If you're listening to the COVID task force, suddenly wear a bandana. And then you're getting other people saying, but why? But you can breathe on someone. But on the other hand, if you're 6 feet away, do this, don't do that. So nobody kind of actually knows. But you've got a regimen of just common sense things that everybody can do and practice self-care to the best of their ability. We have a guy here, I have asthma. Is there anything I can do or should do?
Yes, excellent question. I think one of the things that we have to pay attention to is asthma or any of the categories of airway reactive diseases. Obviously, the relationship between the mind and the body becomes important. So to be able to really move into this situation, the unpredictability with the level of predictability of our maturity and adulthood, will be able to manage that. When we're looking at a predisposition such as asthma or any of the airway reactive diseases, this is a time that the common sense things would be really important. Paying attention. If you are taking any of your inhalers or medications in terms of keeping your airways open and patent, this is, that's what you want to follow. I think Hippocrates was absolutely accurate, and when he said that allow your food to be your medicine and your medicine your food, this is one of those times that I think as a human family, we really are invited to pay attention to what we're eating. Perhaps eating and more of an anti-inflammatory diet would be important. Perhaps eating mostly a plant-based diet, with occasional animal product, perhaps increasing our hydration. Most people are unaware that one of the number one causes, one of the most important causes that leads into hypertension or high blood pressure is dehydration. Believe it or not, it's very easy for patients to come in with a blood pressure that's through the roof, and then when you communicate with them that they've been glued to their favorite news channel, which
Here.
and yeah, right, and then it activates our brain. It moves us into a fight or flight response, or what's referred to as sympathetic response, which is, and it really affects us, especially if you do have a predisposition, such as airway reactive disease, asthma, COPD, and these are some of the things that we could do. And as well as making sure that, steaming is one of the oldest practices that for thousands of years they've done. And you might say, well, I don't have a steam. Well, look, if you have a shower and if you don't want to go in and turn on the hot water and steam, it's fantastic. Why don't you just get a bowl of water and a sheet, and you could maybe add some eucalyptus or various different things in the hot water and put the sheet over you, and in a very safe adult manner so you don't burn yourself, you can really allow the vapor to, as you breathe in through your nose. And it's fantastic. It's one of the quickest way to be able to moisturize the lining of our sinuses. Our sinuses, that is the reservoir where the coronavirus, it really lands. And as you mentioned, the virus by itself, it really can survive up to 3 hours in a droplet. So by being able, if we're going outside, and if you are elderly and you're going outside at 7 a.m. and to get your food and to be able to come back, perhaps before going, you could just simply steam. Most people, they're unaware by just using rose water. Rose water scientifically has been proven that it has antiviral properties. You can mix 1-to-1 dosage, half a cup of rose water, half a cup of water in a spray bottle. You can put it in a boiling water. You can steam it, or you could use it as a spray to wash your nose, your face, or you could use it as an antiviral and antiseptic.
Wow. And of course, I get my steam from coffee, which, by the way, I seem to have permission to drink more of it these days. The virus getting into the throat, and apparently it can live there for about 4 days in the throat, and then it ends up, if you're unlucky, it goes into the lungs, and that's where it wreaks its havoc. It causes the mucus to thicken to the point where the beautiful pink alveoli in the lungs and all the rest of it aren't malleable anymore. They harden, kind of like leather. So you don't want that part to happen. And if you have a warm beverage and pour it down about every 20 minutes, it can wash the virus, this is half theoretical, into the hydrochloric acid of the stomach. And when in doubt, boil it out.
Well, I think what you're saying, it's granted to some extent, it could be theoretical given the novelty of this particular pathology, and we don't have a double-blinded placebo-controlled study. But if we go back to the history of medicine, if we look at 1927, Julius Wagner was a psychiatrist. I think, if memory serves me correctly, the first psychiatrist that won Nobel Prize in medicine or physiology. And it's fascinating. In 1927, we didn't have any antimicrobials. We didn't have any antibiotics. The first antibiotics, Alexander Fleming, was discovered and presented in 1947. And going back to 1927, one of the diseases that if it wasn't pandemic, it definitely wasn't endemic, was syphilis. And it just turns out that syphilis, the spirochetes, the bacteria that causes syphilis, it's very heat sensitive. So with heat, it would completely get destroyed. And given that people were dying and having neurodegenerative issues with advanced syphilis, Julius Wagner, what he came up with, wait a minute, is there a particular disease that creates heat? Oh, yes, malaria. Gosh, I wonder what happens if we infect patients with syphilis with malaria. He did. and patients that they had syphilis completely got cured of syphilis. And then we had medication for malaria, and he would give medication for malaria, and the patients completely got cured. And he won Nobel Prize in Medicine in 1927. So what you're saying, it absolutely makes sense that by consuming a warm beverage every 15 to 20 minutes, it allows us to wash the lining of our mouth and swallowing it. And hydrochloric acid, the pH of hydrochloric acid is low enough that can theoretically destroy anything.
And if you're a dog, it's 10 times stronger. But that doesn't mean you should French kiss your French poodle to enjoy their hydrochloric acid. We do have thresholds of reasonableness here. I'm going to reintroduce you. We're talking to Dr. Habib Sadeghi. He served as an attending physician and clinical facilitator at UCLA Santa Monica Medical Center, currently clinical instructor of family medicine at Western University of Health Sciences. Dr. Sadeghi is also founder of Beehive of Healing, an integrative medical center based here in Los Angeles, specializing in multidisciplinary treatment for chronic illnesses that include osteopathic, anthroposophical, environmental, psychosomatic, family, and German new medicine, as well as clinical pharmacology, regular contributor on Goop, CNN, BBC News, Huffington Post, and publisher of the Health and Wellbeing Journal magazine. And I have another question here. This is a tweet from a lady in Oklahoma, says she thinks she has COVID because she's running a fever, but her lungs are fine still.
Yeah, so that's an incredible question for us to work through and to look at. And the way that I'm going to work with this is the way that I would speak to one of my medical students, one of my interns, residents, or fellows. So when we get a case like this, one of the most important thing would be the age of the patient, number one. We know the gender of the patient, and we know that when it comes to coronavirus and COVID-19 as a pathology, there is a gender predilection for men. Men have a tendency for it to create more havoc and issues. So we have that going for us. So the next piece of information that we want to look for would be the age of the patient. We want to look at if the patient is on any medication, meaning that if she has any type of predisposition, if she has high blood pressure that is not under control, if there is obesity that we have to pay attention to, if she has one of the previous questions and the viewer that we spoke of, if there is any airway reactive disease and so forth. These are the things that I would look at. And then I would have a differential diagnosis. And, you're absolutely right that given the modernity of the technology and so forth, for most people, and that's what really makes this virus so deadly and more of a pandemic, is because there are a lot of people, they have it and they're completely asymptomatic, meaning that they have no symptoms and they don't even know that they have it. And they could be sitting in front of you, they could be shopping, and they could be, speaking to you. And through the aerosol, they're just spraying it and so forth. But if this person, given what we've talked about, and for her to communicate with her primary care physician, her family doctors, and so forth, that can guide them. And this could be done over phone or telemedicine as well, to be able to really dig deep and get more information and to support her. But for now, some of the things that we've talked about, most people, we know that what worked in Wuhan, China, we know that to some extent vitamin C was effective. And when I say that, even if you don't believe in taking supplements or vitamins and so forth, you could, again, going back to what Hippocrates, the father of medicine, said, is that allow your food to be your medicine and allow your medicine to be your food.
Well, and Linus Pauling is no one to giggle at. And we know that megadosing vitamin C, the worst case scenario is you tinkle. And you're flooded with this miracle of vitamin C.
Absolutely. Linus Pauling was the founder of orthomolecular Institute that I'm a fellow with Orthomolecular Institute, and Linus Pauling is one of, I believe, if memory serves me correctly, one of 3 or 4 people that won not 1 but 2 Nobel Prizes, and yes, he did believe in mega doses of vitamin C. And the beauty, if I could just speak briefly about vitamin C, you're absolutely right. If you overdose on vitamin C, the most that can happen is you could get hyperosmotic diarrhea. In other words, you get a diarrhea and so forth. The safe dosage would be you can go up to 2,000 to 3,000. Most people, they cannot tolerate anything beyond 4,000 without getting diarrhea. But you could also get vitamin C from many other places. I mean, you could get it in lemon, oranges, kiwis, turnips. I mean, believe it or not, there are various different recipes. And even on my Instagram at Dr. Habib Sadeghi, we've left recipes for just a turnip soup that people can make and so forth, that they're very, very effective. Vitamin C has been shown to boost up immunity. And this is really what I want to get across, that even the founder of the germ theory, Louis Pasteur, on his deathbed, he's known to say, it's the terrain, it's not the bacteria. In other words, it's really the way that we relate the viruses. And if we boost up our immunity, including NK cells or natural killer cells, by what we eat, hydrations, and the foods that we pay attention, by really breathing through this process, having some type of a spiritual practice and being meditative about it, this is how we can really set ourselves up to be able to have a robust immunity and relate to it for success.
Carrie Harrison with you. This is Corona Alert, and we're doing a long-form interview here. And the purpose of this is not sort of the same punditry basketball, but it's to actually spend a little time with a doctor and understand let's say, the ecosystem of the virus and where we are relative to it and each other, and how our mind, body, and spirit literally do matter. This is not just a medical problem like you're a car with a broken muffler or a bad, it's a wonderful automotive. Anyway, I'll think of it probably 10 minutes from now.
A carburetor or...
carburetor, yeah. So it's not just, well, we're just going to work on the carburetor, as opposed to, well, what kind of fuel have you been using, sir? That's really the point of this conversation, so that you don't have to end up with a glunked up carburetor. We can handle the fuel side of it before anything happens. We now know that 28 million Americans have no health insurance. So these people can't necessarily just stroll into the hospital of their choice. The Affordable Care Act has been rejiggered and no longer favors that kind of behavior per se, and especially during a crisis, there may be no room with triage. So we want to hit this thing and understand it as best we can up front, which leads us then to the next question, Dr. Sadeghi. This is basically the same question from both Facebook and our Twitch feed here, and it's the classic mask or no mask. Should I be walking around with a mask? It's a tough one.
Yeah, well, I'm not sure if it's a tough one. I think the question is to be or not to be. I think Shakespeare really answered that. The answer is it depends. It depends what is it that you're going to be doing. If you're outside and if you're gardening, does that really make sense for you to wear your mask? That doesn't really help you as much as having no mask, so that you could really be able to be there, to get your hands in the ground, to get the sunlight, and to be able to breathe in the fresh air. We know that based on a lot of research, the aspect of the life force or orgone energy by nature, when you look at anthroposophical medicine, which is, in Europe, we have our own hospitals and so forth. We basically is a form of medicine that pays attention to the relationship that you so eloquently verbalized, Kara, which is the relationship between mind, body, and spirit. You're welcome. So being out in nature, wearing a mask. Now, to some extent, if the mask symbolizes fear, anxiety, awfulization, Then perhaps if you're outside by yourself, you're going for a walk, and and you are practicing the level of social isolation, that might be a good idea. But beyond the question of with or without mask, the question is that perhaps we can take advantage of this current pandemic. We could, even though on the surface there is a social isolation, this might be a good time for us to really pick up the phone and have conversations with our loved ones that we've been holding grudges. This might be a good time to speak to our brothers, sisters, parents that we've been estranged from them. Research has shown even far before any of the coronavirus or the novelty of the COVID-19, one of the diseases that the elderly die of is pneumonia. And here we go. Now I'm coughing.
Let's both do it. It's that Los Angeles air, which has improved, by the way, since no one's driving anymore.
No, one of the diseases is pneumonia. And now we know that with the onset of technology, now as they get their loved ones to text them and they text back, they don't get an opportunity to speak. Research has shown when you call another person, especially our elderly, and they get to speak, the process of speaking and phonation, it really creates a vibration that cleans up their lungs. This is a time for us as one human family to really tune in, to have a spiritual practice. And spirituality has nothing to do with any particular religion, and especially during this holy days and so forth with Passover and so forth. This is a good time for us to really reflect and to find out, are we really holding any misunderstandings? Are we holding any judgments against ourselves and against others? We know that even far before this novelty of a virus, we had an epidemic and perhaps to some extent pandemic worldwide. We had really autoimmune diseases. We were producing antibodies against ourselves. You look at autoimmune hepatitis, autoimmune thyroiditis, lupus, connective tissue diseases, rheumatoid arthritis. These are just several, to name a few, of this incredible array of autoimmunity. This is a good time, perhaps, for us to pause and reflect. We have a nonprofit organization. That's why I usually wear a love button, and it's lovebutton.org. And the tagline is pause and love. Perhaps this is the cultural, if you would, global time of pause for us to reflect and to see what exactly does it mean to be a human being? What does it mean for us to be more compassionate, to be more kind, to be more loving, to be more forgiving? I mean, these are the qualities that we can't really order on Amazon or pick it up at Whole Foods or Trader Joe's or your favorite, or Gleason or your favorite, a grocery store. These are the qualities that we have to work through. And we know that gratitude is healing. Yes. In the whole field at Columbia Medical School, they look at narrative medicine. They look at how the thoughts, the feelings, the emotions that we're holding directly affects our physiology and our body.
Well, there's no secret, certainly in Europe, and you're speaking to many of these disciplines, it has been normal, especially in Germany and places like that, where part of your healthcare package is you get 3 weeks to go to the spa. You go to bod this or bod that, and they do practice. So what's your emotional state? What's the rest of it? Because there is, as you pointed out earlier, fight, flight, fear, all of these things create hormones. People have heart attacks at like 7 a.m. because their cortisol levels are high.
Mondays.
And Mondays, Mondays. We live in a country where our entire medical system is based on you must be broken or the system makes no money, versus countries with universal health care, which is, wait a minute, if you're sick, you cost money. So we want to give you, as Canada did for a while, we'll give you a tax cut if you stop smoking. We'll give you a tax cut if you ride a bicycle, because our job is to keep you healthy, not keep you sick so that we can make lots and lots of money. And then we have a second entire industry of insurance people that have nothing to do with you, the doctor, me, the patient. They're like, well, that's kind of cosmetic, getting a new heart. It's cosmetic. It looks good when you're alive. So, this is a really important conversation, I think, especially in these times where all of us, whether we like it or not, are forced to reevaluate who are we and what's our position here. Let's take another tweet, if you don't mind. This comes from New York City. I'm in the middle of the worst thing imaginable. I'm a fan of The Walking Dead, and I feel I'm now living in that scenario. What do I need to know about this virus that they may not be telling us?
The way that I practice medicine, it's based on, we refer to it as entelechy medicine. Entelechy is an Aristotelian terminology. Entelechy is the movement of an acorn becoming an oak tree. And I truly believe that we are souls having a human experience, and we're here on this realm in life for a purpose. And every single individual that's here, if we look at it as a university, this university of life has 7.85 billion students. So your curriculum might be different than what mine is. And your curriculum, your soul will guide you and will help you. So what I would like to leave you with for you to consider is it's far more important that how you relate to this virus than what really scientifically perhaps we know about the virus. I'm not saying that we don't need to know the scientific data about the virus, but what I'm saying is when you look at it realistically, it is far more important how you come into it. And my invitation is that you come into it instead of holding the point of view that there is something that they're not telling you or that you're not going to be protected. Perhaps it would be a lot more uplifting for you if you could consider that you're part of a community, and as a community, we will go through this together. And by really taking care of yourself, paying attention, and really experiencing from every angle the level of support that you need. The greatest support comes from you being able to put the oxygen mask on you. And what I refer to as selfless selfishness. Selfless selfishness is a way of being self-honoring. So instead of, we know that where we look is where we go. If you look into the process of, there is some more to this story that they're not telling me, my goose is cooked, I'm just out there. I gotta watch out for myself. You create so much cortisol. The aspect of cortisol that is not healing for your body. You create so much inflammation and hypervigilance that the smallest thing can really, really harm you. I'm here to tell you that two people, they can go to the same restaurant, order the same food, eat out of the same container using the same utensils. One might get food poisoning, the other one does not. How could this be? If it was the virus, if it was the bacteria, if it was the fungus, if it was the infectious agents, how can we really make sense of this? We know now that the father of germ theory, Louis Pasteur, was right. It's really our buffering capacity. It's the qualities that we have. And a good way of looking at it, my background before even going to medical school was microbiology, medical technology, and I have a minor in electrochemistry. So basically, for a length of time, I was stuck in a dark room looking at things such as viruses, bacteria, fungus, and so forth, and to really make sense of them. And I'm here to tell you that the buffering capacity that you hold is far more important than the infectiousness of the agent. So instead of worrying about what you're not being told, perhaps you could really use your reservoir. You could use your resources to boost up your immunity. Perhaps you could do something that is really uplifting. It could be having a conversation with a loved one over one of the technologies that we have, or chat with someone, or to speak with someone, to really connect. Number one, it could be, and one of the things that I've started doing, and I love doing this, is I started editing and putting small clips of some of my favorite movies and on there. One of my favorite movies is a movie that came out perhaps late 90s, maybe early 2000. It's called The Babies. And it's really the story of four babies. And you can see one baby is from somewhere in sub-Saharan Africa. One baby is from Mongolia. One baby is from San Jose, California. One baby is from Tokyo, Japan. And you can see that the Tokyo, Japan, or San Jose, California, even during pre-birth and during the birth, everything is sterile and everyone is wearing a mask and so forth. Sub-Sahara, that's not the reality. It's just so amazing to see how in Mongolia the baby is born and the baby is all wrapped up like a little burrito. So cute. And then here's the goat that comes in and licks the baby's face. In Sub-Sahara, the baby has started crawling, and the baby grabs onto a piece of bone from the dog's mouth, pulls it out, and starts sucking on it. And then you progressively move forward, and you look at the biography, the downstream, the kid from Sub-Saharan Africa. I mean, they're physically, they're so robust. The Mongolia, the kid early, 9 or 10, they get on a horseback ride, and you can see a higher rate of food allergies, eczema, food sensitivities, and skin conditions, and asthma, airway reactive disease in the children in Tokyo, Japan, as well as San Jose, California. So sometimes really trusting the body and understanding that the body has the resources that it needs to be able to handle what comes at it, it's a lot more uplifting and helpful.
Dr. Sadeghi, just during your saying that, we had a small earthquake. I don't know if you could feel it where you were, but I'm in West Hollywood. You're, I'm guessing, in Santa Monica.
Right. I didn't really feel it because I was so engaged with what I was saying.
I had a little jiggle here. I thought, I'm not going to interrupt him, but I'm just going to watch all the lamps do this and that back and forth. All of this is part of our reality check. I'm just going to reintroduce you. Carrie Harrison here. This is Corona Alert. You can catch us at coronaalert.org. We're going to have some of Dr. Sadeghi's stuff and things that you can have access to that can help you out during these times. We also have radio features running across 85% of America every single day on all your AM and FM stations, plus a variety of videos on those stations' websites. And you can go to coronaalert.org for more. I'm going to cough. Sorry about that.
Completely okay. Nothing
but we
to
know
apologize.
It's the O2 in this joint. At least we hope.
Yeah, it's completely okay. Cough is a reflex mechanism that clears, again, as I said, it clears at the two pipes that we have, and to be able, it's a protective mechanism and it's completely normal.
And one of the tricks, I guess, to figure out if it is a corona, of course, home evaluations are, shall we say in medical language, contraindicated. But if you hold your breath, it can hold it for 10 seconds without any real problem. You're probably doing okay, I would think.
Right. You very brilliantly, you described the pathophysiology of COVID-19, because one of the things that it does, it changes, if you would, the elasticity of the alveoli, which is these small bubble-looking termini at the end of the lungs. And if that changes, the rate of oxygenation across shifts and changes, so you won't be able to hold your breath for that length of time. So that's a quick way of giving you a litmus test of, how best you could really, in a very mature, contained, grounded way, support yourself.
You could see that Dr. Sadeghi has a very large view of medicine, which is great. Anybody who mentions Aristotle is a fan of mine. I know they think they found his bones in Thessaloniki. They think so. So I think I may have to make a pilgrimage there and go and kneel at his dust and DNA. What a cool...
So it is. We'll go after all this is
right?
over.
When it's over. We'll make a trip. We'll go to Thessaloniki and kneel at the bones of Aristotle. To me, that's a bucket list trip.
Yes,
Um,
absolutely.
Dr. Habib Sadeghi served as an attending physician and clinical facilitator at UCLA Santa Monica Medical Center, currently a clinical instructor of family medicine at Western University of Health Sciences. Dr. Sadeghi is founder of Beehive of Healing, an integrative medical center based in Los Angeles, specializing in multidisciplinary treatment for chronic illnesses that include osteopathic, anthroposophical, environmental, psychosomatic, family, and German new medicine, as well as clinical pharmacology. Author of 2 books, The Clarity Cleanse, 12 Steps to Finding Renewed Energy, Spiritual Fulfillment, and Emotional Healing, and Within, A Spiritual Awakening to Love and Weight Loss. Also a regular contributor to Goop, CNN, BBC News, The Huffington Post, and publisher of health and well-being journal Megazen. So Dr. Sadeghi, clearly with your enlightened way of looking at all of this, you've attracted some pretty notable people that we have on our Twitter and our Instagrams and our TV sets every single day, from Gwyneth Paltrow to whoever, who get that you're onto something there. Tell us a little bit about that.
Well, I think as a civilization, times are shifting and changing, and people are really looking at this spectrum where mind and body and spirit is really connected. And I think just like all of us, perhaps people with significant zone of influence, they're interested in that. And they're interested in this outlook that I refer to as intellectual medicine, where our thoughts, our feelings, our emotions, they literally affect us. Most people are unaware. Well, where are these thoughts created? I mean, they're firing of the neurons and so forth. So what do? They create chemicals in our body. They create chemicals such as serotonin, dopamine, things such as melatonin, histamine to some extent, epinephrine, norepinephrine, and so forth. So what do? They affect the body. They create
this
feelings.
is serious brain chemistry stuff.
Absolutely.
When that's out of whack, you have what's called neurochemical dysregulation. You're depressed, you're anxious, maybe you need to
anxiety,
kill something.
Panic attacks.
Sure.
Yes. A lot of things such as we know now that gut produces far more, close to 90 to 95% of serotonin chemical is produced in our guts, not our brain. Only 5% is produced in the brain. And this is now we see the relationship between irritable bowel syndrome and digestive issues to our thoughts, our feelings and emotions. So if these chemicals creating feelings, and then these feelings, they upregulate our hormonal system, everything from pregnenolone, everything from progesterone, cortisol, different forms of estrogen, testosterone, DHEA gets affected, and then they will create a particular emotion. And if you have a particular emotion for a length of time, then what you're dealing with is an emotional set point, or what's referred to as personality. These are people, especially now that we're all cooped up, some people, they might have a lower threshold to be more depressed, more anxious, more hypervigilance, and so forth. And this is all where it comes from. And our food, it really has an effect on it. And we can really modulate that. And they all affect our physiology. They affect every aspect of our physiology, including our immunity.
Wow. I mean, we've all heard this before, and I would give a shout out to somebody who might think, well, wait a minute, these are just, Hollywood elite. Well, you have to understand, to get that elite, you have to be really good. You've got to be quite an achiever, which means you have to be on your game, which means you have to have your brain in a place where you can perform at a consistently high winning level, like a car racer, a NASCAR, like a physician. You have to be on your game. And so you have to pay attention to this stuff. And when you can find physicians who are able to accommodate the mind, body, and spirit, you're onto something. The ancient Greeks knew about this, and they were no layabouts. If you've ever gone to Athens and climbed the steps of the Acropolis, that was not a bunch of people that had nothing to do on a Thursday. So, we're sort of honoring old knowledge and bringing it back and adding a little science and all the rest to it and bringing it back to life, especially now that we're all sitting at home going, well, what can I actually do sitting on my couch? And that would be the next question here, which comes from Twitch. What can I do to help myself? I can't exercise. I can't go out. I can't do anything. I'm sitting on a couch. That can't be good.
That's excellent. In the book, The Clarity Cleanse, one of the tools, it's a form of journaling that I have found to be incredibly effective. And they can actually have access to it. You have access to it if you go on one of our websites, beingclarity.com. Being, B-E-I-N-G, beingclarity.com. And the technology and the tool is referred to as Pew 12, Perched Emotional Writing 12 minutes a day. And what I have found empirically, working with patients with advanced cancer or neurological issues such as MS, Parkinson's disease, ALS, we talk about the Greeks. When you look at the word psychosomatic, the psyche is the soul, is the mind, soma is the body. And they understood that. Now, unfortunately, to some extent, people misunderstand it as if that everything doesn't exist, it's in your body. No, that's not what we're talking about. We're talking about that sometimes, given the busyness of our life, we shove emotions into our body, just sort of like if you have a waterbed, if you press here, this side will pop up. Right. And so a lot of us will go through this. I don't think it's a far-fetched idea if we pay attention to the language that we speak. I can't tell you how many times I'm across from someone and they're here because they're complaining of chronic neck pain. And in the communication, as I'm talking to them, they say that my significant other is a pain in my neck. Or they come in and they have chronic hemorrhoids, and they come in, they say so-and-so is a pain in my, other end. And you're talking to them and they're coming in because they want a fresh, new perspective, outlook, because they don't want to be taking a purple pill and pay $4 to $5 for the rest of their lives because they've been diagnosed with gastroesophageal reflux disease. And in the process, as you're talking to them, they say, I can't stomach my boss. Well, if you can't stomach your boss, is it a far-fetched idea that your body is producing a hyper secretion, a higher level of hydrochloric acid, that it's now coming up and it predisposes you to esophageal cancers and various different things, including sinusitis. So this idea that there is a way that we could journal to really release some of these emotional garbage that we're holding on, it's as old as Aristotle, and we've captured that, and people can practice it as they are sitting on their couch in their home, all cooped up. We can really, and all of us, we can use this opportunity instead of as a holding pattern that we've been incarcerated in our homes. We can use it instead of quarantining. I refer to it as care cocooning. And just like a cocoon, we can use this time as a human family that we really are shedding some of the things, the patterns of judgments and misunderstandings that there no longer serves us individually and collectively as a human family. So that once we go through this, we get access to being able to fly just like a butterfly. That is really, I think, what this is occurring. And I am aware that there is a physical interpretation of COVID-19 and coronavirus, and there's also a metaphysical interpretations. And this is what we're speaking of. And I truly believe that all of us, 7.85 billion of us on this university called life, as we know better, we will choose better. And we are going to give birth to a new consciousness for all of us. But unfortunately, just like any other birth, every birth is bloody.
What a great way to end. I'm so glad we did this. We'll consider it the hors d'oeuvre before the entree, which is to come during another visit. Thank you so much. We're going to put some of your stuff on our website, which is coronalert.org, coronalert.org. coronaalert.org. And also, please send more of your questions to coronaalert.org, and we'll make sure that they get answered by Dr. Sadeghi and many others. We'll have be putting together some protocols and things that can help all of us while we're sitting at home wondering what's next, how do I do it, and we want to make that really easy for you.
Corona Alert with Carrie Harrison. Learn more at coronaalert.org.